I'm Wendy Drysdale, Senior Programme Advisor for the Healthcare Staffing Programme. This is the first webinar in the series of webinars, A Guide to Health and Care Staffing Scotland Act 2019. So the aim and the purpose of the webinar. We're going to give you an introduction to the Health and Care Staffing Scotland Act 2019 legislation and the purpose of the guidance chapters, including a reminder of staff and scope of the legislation and who the Act applies to, those in scope and those that are required to comply with the Act. All of this information and links were originally sent out to participants as part of the communications for the webinar and are available on the HIS website for Healthcare Staffing Programme. So the guidance chapters being discussed today are the guiding principles in health, duty to ensure appropriate staffing in health, agency reporting in health, commissioning in healthcare, and overall reporting in health. So this information is really important, and today the webinar, the purpose is we want to signpost you to the link for the public consultation that you can contribute to on Citizen Space. So to provide further information and presentation, I'd like to present our next two presenters. Catherine Breakin is a professional advisor in Scottish Government, and Sarah Cartwright is the policy officer in Scottish Government.
Thank you, Wendy. If we move on to the next slide, please. So the Health and Care Staffing Scotland Act was approved by Parliament in 2019. However, the implementation was paused due to the COVID-19 pandemic. Following an announcement by the Cabinet Secretary in June last year, implementation was recommenced with all provisions of the Act coming into force by the 1st of April 2024. The aims of the Act are to enable or to provide a basis for the provision of appropriate staffing in both the NHS and in care services, and then through this enable safe and high quality care and improved outcomes for service users and people experiencing care. So whilst the duties in the Act are new, the requirements to have the appropriate staffing and deliver high quality, safe care are not. The Act really builds on the arrangements that are already in place for both local and national workforce planning in health and care services. Implementation of the duties will support decisions made about staffing requirements, service delivery models, and service redesign. The Act will promote transparency and support that open and honest culture with our staff. So staff should feel engaged in the process, informed about decisions relating to staffing requirements, and feel safe to raise concerns that they have that relate to staffing and that high quality safety for patients. The Act enables Scottish ministers to issue statutory guidance. Statutory guidance aims to explain the provisions of the Act and assist organisations affected by the Act in how they implement the requirements of legislation. So draft statutory guidance has been prepared by the Scottish Government in collaboration with key stakeholders from across health and care sectors to ensure that it's clearly presented, coherent and accessible. The aim of this suite of webinars is to raise awareness of and to introduce the draft statutory guidance chapters and engage you within the public consultation exercise. There'll be more information around the public consultation towards the end of the webinar. If we could move on to the next slide, please. So who does the Act apply to? Well, first of all, there's 4 parts to the Act, and these are Part 1, the guiding principles for staffing. Part 2 is staffing in the NHS. Part 3 focuses on staffing in care services, and Part 4 are general provisions. So the Act places different duties on different parties involved in providing health and care services. So as highlighted in this slide, that includes territorial health boards, special health boards, which would include the State Hospital, Scottish Ambulance Service, NHS 24, and the National Waiting Time Centre Board. It includes the Common the Common Services Agency, better known as NHS NSS. We've got local authorities, integration authorities, and care service providers. There are also specific duties within the Act that apply to Healthcare Improvement Scotland, the Care Inspectorate and Scottish ministers. So Healthcare Improvement Scotland and the Care Inspectorate have been commissioned by Scottish Government to support NHS providers and care service providers prepare for the Act. However, following enactment, they will have specific duties and powers in relation to monitoring compliance with the duties and in relation to staffing level tools and staffing methods, and these will be covered in future webinars. There are specific staff groups and staff roles included in the Act. However, the Act does not list the staff groups specifically within the provisions. So Scottish Government has published a guidance to which roles would be included, and this is available on Citizen Space alongside the consultation information, and we'll signpost you to that again later on. The list itself doesn't form part of the statutory guidance, but will sit alongside that as a living document which can incorporate new roles or changes that occur over time. But for healthcare, broadly speaking, it's the clinical roles that are included within the scope of the Act. So, for example, nurses, doctors, dentists, allied health professionals, healthcare scientists, among others. Our non-clinical roles, which are absolutely essential to delivering safe care to our patients in the NHS, are not within the scope of the legislation, such as domestic and maintenance staff, but absolutely remain critical to our overall workforce. So as stated in the introduction, today we're only going to be covering requirements for NHS healthcare providers around ensuring appropriate staffing, the guiding principles, using third parties to provide services, use of agency staff and reporting in health. Next slide, please. So we have the duty to ensure appropriate staffing in health. So Section 12IA is that duty that's often referred to as the general duty. So the Act itself makes provision to allow two general duties, this one for health, and there is a similar general duty for within care services. And the general duty outlines that NHS boards should ensure at all times they have suitably qualified and competent individuals from such a range of professional disciplines as is necessary and are working in such numbers as are appropriate for the health and well-being and safety of patients, the provision of safe and high quality health care, and then insofar as it affects those matters, the well-being of staff. Staffing therefore must consider both the numbers of staff, but also the skill mix and skills that those individuals have, and ensuring that the staff have the necessary qualifications as well as the competencies to meet the needs of those who are receiving healthcare. So when considering what is meant by the health, well-being and safety of patients and the provision of high quality healthcare, organisations should be looking at publications such as the Health and Social Care Standards, which state that high quality care should include considerations of dignity and respect of service users, respect and promotion of their human rights, thinking about compassionate care and support, including service users in making decisions about their care, providing responsive care which adapts to the needs of that service user, and the care which improves well-being. The third bullet point requires that the well-being of staff is considered insofar as it affects those two matters. So where it relates to the quality and safety of care and improved outcomes of people receiving care, it's important that we're considering the well-being of staff. So there's a link absolutely between the safety of service users and the well-being of staff. So increased staff well-being can reduce sickness absence, burnout, work-related stress, meaning that staff are therefore available to care for patients. Healthy, engaged staff are also better able to provide that safe, high-quality service. So there's a really strong link between staff well-being and that high-quality, safe care for patients. Staff need to feel safe to raise issues about patient safety. Mistakes are areas of concern, and this involves creating a culture of transparency, continuous improvement and open communication, where it is clear that the organisation has a culture of improvement rather than blame. It's important that this does not replace existing requirements in relation to the health, well-being and safety of staff, such as the health and safety law or any contract of employment. So the Act and how it applies in terms of the well-being of staff absolutely sits alongside those contractual arrangements, but also the health and safety legislation. Next slide, please. So healthcare services vary enormously, and consequently the staffing numbers and skill mix required for any particular service and any particular location will vary. And it's important that we think about the people within our care as well as the local context that we're delivering that in. So Section 12IA goes on to state that when an organisation is determining what constitutes appropriate staffing, then they should have regard to the nature of the particular kind of healthcare provision. So thinking about a high dependency unit will have different requirements to prisoner healthcare services, for example, which again will be different to a community service. The local context in which it's being provided. So this could include factors such as geography. So if you're delivering care in a remote or rural area as opposed to inner city, there may be a different staffing requirement associated with that. And then thinking about the different types of service delivery models that are being used again in those different contexts. The number of patients being provided to, and this should consider both met and unmet need. The needs of patients being provided to. So again, recognising that individual person receiving care, so no two people are the same, and the outcomes that matter to each person will be different. And then lastly, appropriate clinical advice. So the provision of clinical advice is central to securing appropriate decision making and actions, and this provision is contained in a number of duties in the Act, not just the duty in relation to appropriate staffing. Next slide, please. So as I said before, the duty to ensure staffing in healthcare services is one of two general duties created by the Act. As we've noted earlier, the duty applies to all NHS services provided by health boards, NHS NSS, special health boards who provide direct patient care. If a health board has delegated the delivery of healthcare services to an integration authority, then that authority must also comply with this duty. So the aim of the duty is to enable that provision of safe and high quality services which meets the needs of the service users through having appropriate staffing with the right person, with the right skills available in the right place at the right time to provide the care that that individual requires. The duty sits alongside existing requirements such as those relating to staff governance and clinical governance, and along with workforce planning, which already takes place within organisations. So similar to discussions before, this should strengthen a lot of the arrangements that boards have in place. It doesn't replace them. The legislation is not prescriptive about staff numbers or skill mix of professions. It doesn't prescribe minimum staffing levels or fixed ratios, and it doesn't seek to preclude the use of innovative new models of care delivery. Rather, the outcomes from the duties seek to inform and support local decision making, flexibility, and the ability for boards to redesign and innovate in terms of healthcare delivery. It's also important not to fall into the tools trap. So the use of staffing level or workload tools is only one element of one duty in the Act and is required for certain types of healthcare locations and employees. You don't need a tool to be able to ensure appropriate staffing is in place. And whilst it's a really valuable resource and tool to help support workforce planning where it applies, the detail of the duties extend beyond a simple staffing level tool. Next slide, please. So most of the other duties within Section 4 of the Act, which is the staffing in NHS, exist directly to support that overarching general duty to ensure appropriate staffing. And as we can see in the diagram here, we've got the different individual duties highlighted there. So these are the duties really that sit beneath that overarching general duty and support boards to deliver that. So as an example, the duty to have real-time staffing assessment in place and the duty to have risk escalation in place are critical to ensure that you have appropriate staffing in place to meet the day-to-day requirements of individuals in your care. The individual duties, some of them will be covered today and others will be picked up in our future webinars. Next slide, please. So the Act requires that the general duty is discharged with regard to the guiding principles. Section 1 of the Act details a set of guiding principles for health and care staffing, which we will consider in a bit more detail in a moment. But when carrying out the duty to ensure appropriate staffing, organisations must have regard to the guiding principles. So the two absolutely go hand in hand when you're thinking about compliance. So we've got the general duty that we've talked about, 1(2)(IA), which is the duty to ensure appropriate staffing. And then we've got these additional duties that sit underneath that to support the compliance and delivery of that duty. And then we have the guiding principles for health. So sitting together, they will help enable that high quality, safe care, best outcomes from patients, and will support the compliance of the legislation. Next slide, please. So we're talking more about the guiding principles here. So the duty to have appropriate staffing, along with the guiding principles, together underpin the outcome of the Act, which aims to achieve so the key principles. So the key principles explain what people using healthcare services can expect. So, for example, as we've said before, about ensuring that we respect their dignity, their rights, and also that we take into account their views. The guiding principles also explain what those who work within the health services can expect. So, for example, taking account of their views and ensuring their well-being. It details the requirements of relevant organisations, for example, the provision of that safe, high-quality services, and outlines the actions required of those who are involved in making decisions about staffing, such as taking account of the particular needs, abilities, characteristics, and circumstances of different service users. The guiding principles have been developed to ensure that decisions made about staffing are aligned with wider health and social care policy. Next slide, please. The Act states that the main purposes of staffing for health and care services are to provide that safe, high quality service and to ensure the best health care and care outcomes for service users. The Act goes on to list a range of factors that should be considered insofar as they are consistent with those two main purposes by organisations when they're arranging staffing. And we're going to look at these next. So if we could move on to the next slide, please. So what are the factors that should be considered? So the first one is improving standards and outcomes for service users. So this could include considerations of outcome measures, trends, whether staffing has had an impact on those. Taking account of particular needs, abilities, characteristics and circumstances of service users. So a very person-centred approach should be used, which involves those service users and decisions that meet their needs. So thinking about that shared decision making. Respecting the dignity and rights of service users. So services should be underpinned by a human rights approach. Taking account of views of staff and service users. So organisations should have systems and processes that allow the gathering of views and feedback from both staff and those people who are accessing and using services, and then also think about how they can demonstrate that the views have been heard and have been used to inform decision making around staffing. Ensuring the well-being of staff, as we've discussed earlier, so ensuring that our staff are well informed, that they are engaged in work and are supporting the legislation. Being open with staff and service users about decisions on staffing, so again, that really critical feedback. Allocating staff efficiently and effectively. So, for example, through the use of effective rostering or real-time staffing resource, ensuring that we have got the right number of staff with the right skills supporting patients in the right place. And then promoting multidisciplinary services as appropriate. So whilst the legislation doesn't require us to to deliver a multidisciplinary service, recognising that that's not always appropriate in all settings, we're encouraged to think about whether a multidisciplinary approach to delivering care would be appropriate in different circumstances. I'm now going to hand over to my colleague Sarah for the rest of the presentation. Thank you.
Thank you. So the next thing we are going to look at is the provision of healthcare from other providers. So health boards and those relevant special health boards providing direct patient care and NHS National Services Scotland will provide some services directly to patients using their own employees. For example, they'll carry out an operation on a patient using its own hospital and using its own staff. However, there are other services they will provide through the use of third parties. You know, these are variously referred to, they can be referred to as commissioned service or contracted services. So, for example, instead of carrying out that operation in their own hospital using their own staff, a local health board may refer a patient to the National Waiting Time Centre, or they could commission the operation using a private hospital. In addition to this, NHS boards also provide other services. So, for example, GPs, dentistry, optometry and pharmacy services. And these are not provided directly by the NHS a lot of the time. These are provided by independent contractors. So this could be the local GP practice, it could be the high street pharmacies or your high street optometrist. Now, such arrangements may be local to the local health board, to the individual health board, or they may be procured through national agreements. Next slide, please. So Section 2 of the Act places the requirements on health boards, relevant special health boards and NHSS when they are planning or securing the provision of healthcare from another provider. And this is through all contracts, agreements or other arrangements. And this is deliberate, this wording is deliberate to account for the wide variety of contracts or agreements or other arrangements that are made by health boards with other third-party providers of healthcare. So when planning or securing the provision of healthcare, the organisation must firstly have regard to the guiding principles for health and care staffing. So these are the principles that have been just discussed in the last few slides. So when a health board is looking at a service and looking at a provider that is a third-party provider, they must look at these guiding principles and think how they are going to be met using that third-party provider. They also must look at the need for that provider to have appropriate staffing arrangements in place. So again, this goes back to the general duty under the Act in terms of the NHS provider having to have appropriate staffing in place for that safe and high quality service. And this applies equally if you're actually getting a third party provider. So obviously, as a patient, you want to have access to care that is safe and of high quality, whether that care is delivered directly by the health board or whether that care is delivered on behalf of the health board by a third party. Now, the Act doesn't detail how this should be carried out. It does not stipulate that, for example, specific clauses must be added to contracts. It's left up to the individual organisation to incorporate this, but it does mean that they have to consider these factors when they are planning or securing such services. So, for example, it could be that this is incorporated into existing procurement arrangements. It could be that you look at existing data, for example, Healthcare Improvement Scotland data for inspection of private healthcare services. Maybe that will provide you with such information about, does that provider have the appropriate staffing arrangements in place? Because the range of contracts and agreements is quite wide, and different boards will have different procedures, existing procedures in place. That is why it's left up to the individual board to be able to incorporate these requirements into their existing procurement commissioning services. So it's envisaged that these could be updated to include the requirements of the Act, but not forgetting that also you still have to comply with all other procurement legislation and consider other factors that you normally would when planning or securing a service from another provider. Next slide, please. So an important part of the Health and Care Staffing Act is the reporting. And under the Act, health boards, those special health boards that are providing direct patient care, and NHS NSS will have to submit an annual report to the Scottish Ministers. This will happen at the end of each financial year and will tell the Scottish ministers how that individual organisation has carried out their various duties and requirements under the Act. Now, the point of these reports is to gather information. They will enable monitoring of the impact of the Act. So what impact has the Act had on quality of care provided to patients, along with the well-being of staff? And obviously, we're looking at the quality of care to improve. We're always looking for improvement in standards, improvement in patient experience and quality of care provided to patients. And these reports will enable us to monitor that. It will also identify any areas of good practice that can be shared. So, for example, one board may have implemented the Act in one area or across the board in a particularly innovative way, and that could be shared across the other boards that are maybe struggling or have not managed to implement it in such a fashion. On the flip side, it will identify any challenges that boards are facing in meeting the requirements of the Act, and importantly, what steps they've taken or will take to address those. So that looks at individual boards, but also because we're getting reports from all boards, looking across the boards, we can also look at trends. So are there any trends in challenges? Are they related to the implementation of particular duties in the Act? Or are there particular issues with particular services? So particular areas of healthcare or particular professional groups where it has been harder to carry out those duties compared to other areas. These reports could identify any improvement support required. And again, that could be on a board by board basis or any improvement support generally across several boards across the country. And for example, that may be that there is a deficiency in training requirements and we need to look at more training resources for staff. It will also inform Scottish Government policy. So this will be on workforce planning and staffing in the health service. And this will contribute alongside all the other sources of data that are already collected about workforce to inform policy for the future on workforce planning and also on staffing in the health service. Next slide, please. So the reports received by the Scottish ministers are then going to be collated and laid in a report before the Scottish Parliament. And here we can see those duties which are required to be reported on. So highlighted here is section 12IA, and this is what we've just been talking about in terms of the duty to ensure appropriate staffing. All the other duties, which are in green in this diagram, also are required to be reported on, and we will consider those reporting requirements in the appropriate webinars in the rest of the webinar series. So once the Scottish ministers have received these reports, they must be collated and then laid in a report before the Scottish Parliament. But importantly, the Scottish ministers must also lay an accompanying statement. And this will detail how they have taken into account or plan to take into account in the coming future the information they have received in these reports when they are designing policies for staffing in the health service. So it will make that link between the information received from individual boards and how that's going to be incorporated by the Scottish ministers for overall workforce planning. So as I say, section 12IM requires the boards to report on each of these duties. So firstly, organisations will need to say how they have carried out the duty during the year. So for section 12IA, how have boards carried out that duty to ensure appropriate staffing throughout the year? And also, how have they had regard to the guiding principles when implementing that duty? The board will then have to detail whether they've faced any challenges or risk in carrying out that duty to ensure appropriate staffing. This may be challenges, for example, with particular areas of healthcare. It may be challenges with particular staffing groups. And what risks have they faced when carrying out this duty. Allied to this, they will then need to detail what steps they've taken or will take to address those particular challenges or risk. Now, in order to ensure consistency of information and to provide boards with guidance on reporting, all organisations are going to be provided with a reporting template to complete, and this will come complete with guidance on the type of information and the level of detail that should be included in the report. And this reporting template is currently being tested by a number of health boards, along with widely testing the guidance to ensure whether it can be understood, whether it's user-friendly, whether it meets the requirements of the Act, and also any improvements that we will need to be made before the Act comes into force next year. Next slide, please. So in addition to that duty 12 IM in terms of reporting on staffing, there are other requirements on reporting throughout the Act. And this means that health boards, special health boards and the NHS NSS will need to, first of all, provide information on the steps and how the steps they have taken to comply with the duty to ensure appropriate staffing have improved outcomes for service users. So again, if we look back to the general aims in the guiding principles, what we're looking for is for that appropriate staffing to ensure the provision of safe and high quality care for those experiencing care. So in this part of the reporting, we are linking how have you implemented that duty, and after implementing that duty, how has that improved the outcomes for your service users? Looking back to when we have planned or secured the provision of healthcare from another provider, organisations will also need to report on this. So if we remember from the last few slides, those organisations, when planning or securing healthcare service, need to consider the guiding principles for healthcare staffing and the need for that provider to have appropriate staffing arrangements in place. So the reporting for the providing of those third-party services will include those two things. What steps have organisations taken in order to comply with that requirement to consider the guiding principles, and in order to consider the need for that provider to have appropriate staffing arrangements in place? And again, going on, how have these steps then improved the outcomes for service users? Again, we are looking for one report per health board, and so that could be the health board delivering services themselves, or it could be that they have delegated those services to an integration authority. So it will require the integration authority and the health board to collaborate on producing that report, and those reports will be due in just after the end of the financial year, so at the end of April of each year. Next slide, please. So the last duty we're going to consider today is that of using agency workers, and specifically the use of high-cost agency workers. And again, this duty applies to all health boards, those special health boards that provide direct patient care. So here we're looking at for example, the State Hospital, the Scottish Ambulance Service, the National Waiting Time Centre and NHS 24, along with NHS National Services Scotland. Now, obviously, it's recognised that in order to comply with that general duty of ensuring appropriate staffing, it may be necessary to use agency workers. Now, clearly, there is a cost involved in the use of such workers. And the Act states that this should not exceed 150% of the amount that will be paid to a full-time equivalent employee of that organisation to fill the equivalent post for the same period. So as we're looking like for like, the directly employed worker of the organisation compared to utilising that agency worker. Now, however, if the organisation does pay more than 150%, then the Act requires them to report this quarterly to the Scottish Minister. So each quarter, there will be a report submitted by the Health Board or the relevant Special Health Board or NHS NSS. And these reports must detail the number of occasions on which it's paid more than 150%. The amount it is paid on each of those occasions. So this would be expressed as a percentage of the amount that will be paid to that full-time equivalent employee. So for example, it could be 180%, 190%, 200%. And also the circumstances that have required that higher amount to be paid. Now, currently we're working with the providers of the Staff Bank software system, along with representatives from the health boards, to see how this data can be recorded and reported automatically. So firstly, we want to show consistency of data across Scotland. But equally important, we want to reduce the administrative burden on health boards. We want to be able to collect this information easily using existing systems, and we want to be able to report automatically every quarter to prevent the having manual updates of data and having to collate data from several databases. And again, this will form part of our testing with the various health boards to see how those reports can be carried out and what we would need to do to make that user friendly. Now, under the duty regarding the use of agency workers, once Scottish ministers have these reports, they must then publish them, along with the amount spent on all agency workers. And that is in such a manner and at such intervals as they consider appropriate. Next slide, please. So just to conclude, we have launched our public consultation of the statutory guidance that has now commenced, and it's going to run until mid-September. So we are encouraging everybody to get involved with this. Once the guidance has been published on the 1st of April next year, organisations will have to have regard to it when they are carrying out their duties under the Act. So clearly it's important that the guidance is clear, that it's understandable, and it contains relevant information in such detail that helps organisations in carrying out their duties under the Act. So the public consultation is hosted on Citizen Space. So if you go to the Citizen Space platform, just write Citizen Space in Google, you will see all the live consultations, of which the one on the Health and Care Staffing Act will be there. You'll be able to read the draft guidance, and you'll be able to then comment on it, answering questions about whether it is clear, whether it is understandable, and whether it contains that relevant information. And if it doesn't, you'll be able to provide comments about which bits you think are unclear or which bits you think could do with improving. So I'll now hand back to the Healthcare Staffing Programme, HIS, just to conclude this webinar. Thank you very much.
Thank you, Catherine and Sarah, for providing this presentation and information. In addition to the information provided, I would like to signpost you to the learning resources that are available. The Knowledge and Skills Framework for Health and Care Staffing in Scotland. Currently, this sits on the NES 2RAS platform. There is level 1 for informed and level 2 for skilled. 2 other levels for enhanced and expert are currently being developed. Also, quick guides are available. Next slide, please. So thank you for listening to the webinar. Your feedback matters and is important for us. If you would like to give us feedback, if you would scan the QR code with your phone and be able to provide any feedback. Next slide, please. So any questions, the contact details for both the healthcare staffing team and healthcare staffing programme are available on the screen. Thank you.